how big of a problem is mental health today?
Some information from National Institute of Health and NAMI. 1 in 5 U.S. adults experience mental illness. 1 in 20 experience a serious mental illness, such as schizophrenia or bipolar disorder. Suicide is the second leading cause of death among young people ages 10 to 14. 50% of lifetime mental illness begins by age 14 and 75% by 24. So, some of these numbers really highlight how pervasive of an issue this is. Since the pandemic, we've seen a major uptick in the demand for mental health services. People are now experiencing in the past 3 years, unprecedented external stress, stress in the home, compromised living situations. We saw these incredibly long lines for food pantries.
So what is Oaks doing to help?
We're always on the forefront of trying to introduce and implement, new models of care and really try to, do our best to meet the needs of our communities. And so we were fortunate enough back in 2017 to be selected as a demonstration site for the brand new certified community behavioral health clinic model. Oaks piloted that project in Mercer County. It was a partnership with the state. We were one of about 70 organizations in the country to be piloting this certified community behavioral health clinic model. And since then, there's been tremendous growth in terms of this, what we call the CCBHC model, being implemented and expanding throughout the country.
The CCBHC, which is a lot of letters.
Yes.
Is that an actual building where I would go?
The CCBHC it represents physical sites as much as it also represents a concept and an ideology. So throughout our different communities that we have our CCBHC program in, we might have a main site, such as Mercer County. We have a location on East State Street in Trenton, as well as a location on Brunswick Pike in Lawrenceville. In Burlington County, we have our main campus on Wood Lane Road in Mount Holly, as well as some satellite facilities throughout the community, like our Yates Center in Lumberton, which really focuses on kids and families, and some smaller outpatient sites. In Camden County, we have our facility on Cross Keys Road in Berlin, as well as some other sites that might offer addictions treatment services and outpatient in Camden County, or urgent care mental health in Camden County. And then down in Cumberland County, we have 2 sites in Vineland. The main draw and the main benefit of our CCBHC is, as much as we have folks coming to our facilities and delivering services at our sites where we have this robust continuum of services for them, we're also in the community, in the home, and we're helping people in their natural environment and helping them to address the entire spectrum of needs that they may have as an individual to get well. And a lot of that does have to happen in the community as much as it has to happen at our sites.
Interesting. So if you talk to someone and they're having a problem with depression, so what all are you looking at?
So somebody who might be dealing with major depression or something along those lines, it varies from person to person, which is what's great about the CCBHC model, because it is very much person-centered. But somebody who's experiencing depression, they may come in and they may have issues in terms of access to housing. They may be having, challenges or struggles finding employment, or with maybe continuing in their educational path. They may also have some physical health issues, right? So our CCBHC program is able to admit that person, figure out what kind of treatment do they need to help combat the depression, whether it's individual therapy, group therapy, a combination of medications, partial hospitalization or partial day services, or maybe outpatient. But then in addition to that, we may have peer recovery specialists, nurses, and care managers and care navigators who are working with that individual on any number of different parts of their lives. So our nursing team may help to monitor some physical health issues, right? And one of the things we know about mental health and physical health is that they're very much connected, right? So we oftentimes see what we call like comorbid physical health and mental health diagnoses, or substance use diagnoses in individuals, and trying to untangle somebody's depression and their physical health issues. It can be quite difficult when you're dealing with them independently. So what we're seeking to do with this kind of diverse team of professionals is really help to address these things and help them to connect the dots as well. So that is, we're helping them to get well with their depression. We're also helping them to get well physically. And then we can never forget, the importance that employment, education, those things really play into somebody's recovery and somebody's wellness. The individual's reason for being well or getting well is often rooted in who they are, what's valuable to them, what's important to them. And if it's maybe, being a good parent or being, in their educational program and pursuing a career path or remaining employed, right? These are the reasons people want to get well. And these are the things that we also have to consider helping them with if we are really going to help them to get, to meet those goals and to be, the best version of themselves that they can be. So that really is kind of the picture of what we try to create and what we try to help people with